Hi, my name is Juan, and welcome to The Couch, a podcast where real therapists talk about real things. Please remember that we are therapists, but we are not your therapists, and this podcast is intended for educational purposes only. All right, my friends. So the focus for today's episode is what this season is all about, which is kids. Right, the topic of therapy for kids, how to help our kids be successful. And let's open up this conversation on a really common diagnosis, ADHD. Now, I'm not sure how familiar you are with ADHD. We at Santos Counseling, we see more and more of this. And let's kind of go into just some background research. And this pulling from the CDC, which a lot of the research, it's hubbed there, but it pulls from other areas. So breaking down ADHD, attention deficit hyperactivity disorder. This is not just a diagnosis that's for kids. This could be for anyone in that age spectrum, adults and so forth. And something that you may notice if you think about ADHD, a lot of people go, ADHD, yeah, that means the person can't sit still, right? Or they have a hard time being patient, right? Fidgety, maybe squirming in their seat, right? Those are often very common behavior symptoms that most people will align with ADHD. Pulling from the research, one big statement that I see on this site is millions of U.S. children have been diagnosed with ADHD. Estimated 7 million, so it's about 11% of the U.S. Children between age 3 and 17 years. So from a practice point of view, this is where I like to kind of pull your attention in. ADHD, there's a lot of talk if it's overdiagnosed. Is it underdiagnosed? Is it more diagnosed in this population than another? Instead, what I want you to look at, and this is just my viewpoint, and just for reference, this is Dr. Juan Santos with Santos Counseling. So I'm going to give you my viewpoint. My viewpoint is that when we look at ADHD, I look at it from a position of executive functioning, and here's why. So you have ADHD, attention deficit hyperactive disorder. And then there's symptoms in there, right? So common symptoms like with kids are going to pertain to the hyperactivity sector, the inattention sector, and the impulsivity, right? So then if we break those up, you have hyperactivity. You may notice that your child is restless when sitting down. Your child may have a hard time keeping their hands still. Maybe like waiting in line is difficult for your child. Let's say you're having lunch or dinner. Your child may struggle to finish their meal in one position, right? Like sitting still, one position, and getting through this meal. Maybe during early childhood development, like those toddler years, your child could have displayed restlessness. And I'll give you an example of this. This could be like where you may need it to have waddled, like almost like place your child like this burrito format, if you will, because they just had a hard time sitting still, right? They were squirmy a little bit. That's hyperactivity, right? That we see in children. In a classroom, it could be that the teacher's saying, hey, this 14-year-old's having a hard time just waiting patiently to answer a question. So, an example of that could be that the teacher says, hey, what's 7 times 46 divided by 22? And raise your hand. And your child's raising their hand, but then they blurt it out, right? So that'd be an example there. The other category of ADHD is inattention. So here, you may notice that, let's say during a conversation, your child goes in and out, right? They have a hard time with that focus or shifting their focus to a particular attention. So that could be that you're telling your child after they just gotten into some kind of really big trouble. Maybe they didn't clean their room or they were talking back, and you're giving them one of those great lectures. Maybe during that time they struggle with inattention. They're kind of focusing on something else and then coming back. Often when I'm working with my clients, especially the kiddos, I'll begin a conversation, and then I will, maybe a quarter way through it, I'll say, let's pause here. From 0 to 10, 10 being you're paying a whole lot of attention, and 0 is like hardly any. Give me a number. And a lot of times when the child may share with me, I'm at a 4, or yeah, I was really not focusing on what you were saying. And I share this with you listening in as parents because it's helpful to keep that in mind. If your child has a diagnosis of ADHD or they display symptoms connected to ADHD, more than likely they're going to have a difficulty there. And keep in mind, remember earlier I mentioned executive functioning. So I want you to think about that. And I'll come back to it in a moment. With inattention, your child may have a hard time finishing a movie without getting distracted, or finishing a task without getting distracted. So maybe you're watching a family movie, next thing you know, they're jumping towards something else that they want to do. Now we have impulsivity. And let me just tie one more item in. A lot of these, they can add to different areas. So as an example, let's say inattention. If your child is showing this behavior, this symptom of inattention, that could be in a classroom, they're trying to pay attention, but then they're getting distracted with that window view that's really awesome stuff out there, and they rather see that than what's happening in the classroom because maybe they're not interested as much as what's taking place in the classroom, and the ADHD symptom is pulling them in that direction of inattention. Now what can happen is your child can shift into the category having an additional challenge, and the challenge could be that they may have a label, and the label could be not paying attention, or it could be internal. It could be that your child gets their test back and they're like, oh my goodness, I got a C. This is ridiculous. And now they're maybe struggling with some self-esteem. So I mentioned this because as parents, it's important for us to get to know our child's diagnosis and not look at it as a label, but instead look at it as a what do we do next? I had this really great example of a training I did, and it mentioned look at ADHD as diabetes, meaning that you are engaging in multi-level treatment. So there's medication, but there's also fitness, and there's also nutrition, right? So already you have 3 categories of an approach that you can take to support with diabetes. And here when it comes to ADHD, there's multiple, layer upon layer of things that we can do, all the way from medication to holistic approaches. Going into impulsivity. Impulsivity, your child may struggle while waiting their turn during a conversation. And this could be that your child jumps in and interrupts, maybe a bit too often. Impulsivity too can lead to unwanted behaviors, so that could be where your child may lie, right? They may display dishonesty because they're not really thinking through, which is another symptom of ADHD, the struggle to think through decisions. Here, you may notice that your child is, playing a family board game, and they struggle waiting their turn. And this could really show up at a young age. This could also show up at a young age where maybe your child's like in elementary school or pre-K, and they're getting in trouble. Maybe they're not as, let's just use the word patient as another child. And it's not because something is wrong with your child. It's just a symptom here, right, of ADHD. And it means that this sector of ADHD impulsivity, it may be showing up in that category of life. The other component of impulsivity with ADHD is risk-taking behavior, right? And that really just depends on the spectrum of age. It could be, later teenage years, drinking and driving. It could be middle school years of, trying a substance. Early sex, and the list really goes on. And this is not, please bear with me, this is not to scare a parent. And myself having ADHD, my child having ADHD, it is not to scare. I've known for a long time that I've had ADHD. Went through college, did some testing there, and seeing my daughter grow up, I saw a lot of that impulsivity. She's just got something to tell me, and she has such a hard time waiting until her brother's done speaking, or we're in the car and she's just squirming to get out. I'll tell you a story, and this is probably one of the strongest indicators. When she was little, right out the womb, if you will, we had this swaddle blanket, and I kid you not, the way that she would sleep is that we would have to, and we had one of the swaddle ones that you would have to like wrap the child, right? So I would wrap her in this like really neat burrito. And if you recall, once your child comes into the world and you're in the hospital, they give you that big blanket, and then they teach you how to do the like the burrito method is what I call it, where you swallow your child really tightly. That's how she would sleep. And later, what would take place is if her arms got out of that swaddle, she's just reaching for everything. And it's like her comfort position as a child, it was in the swaddle. And it's because so much energy was like just built in there. And that's always something that stuck out to me as far as, I think that's an early sign there for her of ADHD. With ADHD, let's go back here, because you remember that I said ADHD has a lot to do with the executive functioning. So I like to look at it executive functioning, because when you think about executive functioning, right, I want you to consider what comes to mind. Executive functioning, if we look at skills, right, this is your skill to plan, to focus, to think before you speak, think before you do. Self-control, which goes a lot into controlling impulsivity, controlling emotions, or managing emotions, managing impulsivity. Focus. Executive functioning goes into your focus. That's that prefrontal, right, portion of the brain. It goes into your flexibility to deal with new situations, your ability to problem solve, your ability to think things through, to take step-by-step action, to see a big picture and organize it and know how to approach it, to maintain a schedule, to maintain organization, to know where your things are at, to be able to ask for feedback, to be able to practice self-awareness, right? And the list goes on and on and on. So executive functioning is working memory. It's your organizational skills, your ability to initiate tasks, complete tasks, follow through on tasks, your ability to pay attention, to plan and prioritize what needs to be done, to engage in short-term memory, study for a test and be able to retrieve that information, to monitor yourself and know why you're doing what you're doing and how what you're doing impacts right now, impacts tomorrow, impacts your future. All of that is executive functioning. So here is the years, and I've been practicing for a little bit over 10 years. So I'm not going to share with you that I'm an expert in this. I am learning and growing. I've done a lot of training in ADHD, personal experience in ADHD, working with a lot of patients in ADHD. And this episode is focused on kids, right? Helping our children. So if you notice that your child is showing symptoms of ADHD, which I shared some there and I'll share some more, talk with a counselor, speak with your counselor. And it's okay if the conversation grows a bit, that's the goal. A few other common symptoms of ADHD: fidgety, restless behavior. Again, it's a common one. Excessive talking. And it's not that, the individual just can't stop talking or they're doing it on purpose. It's a mixture of that impulsivity, right? So they're impulsive and they're blurting out things. It's a mixture of they're not thinking through of the impact of speaking out of line and how that affects the moment in the future. Maybe your child gets homework and they come back and the homework is lost. Maybe you tell your child, I need you to clean your room, take out the trash, and then organize the drawer, and they get stuck after number 2. With ADHD, I had this other really neat example provided to me, and it said having ADHD unmanaged, it's like being this really elderly individual. You're like this old man, and somebody comes up to you and says, hey, I need you to do these 6 tasks. And after the second one, you're like, what? Or they're speaking to you, and they're telling you all of this stuff, and then they're like, are you even paying attention? And then you go, you know what? I zoned out, right? And it's no fault to this individual, right? The individual's elderly, right? Their working memory, their executive functioning, that those skills, they, there's a little dirt over them, right? So as a parent, that concerned me. That's why I got really involved in ADHD and continue to learn as much as I can about it, because I really want to make sure I'm showing up for my daughter, and I know how I feel about that, and I want to make sure I'm showing up for the patients that come to Santos Counseling and trust us with care. So counselors with the practice, we are just growing and getting a lot of training in this area to be able to effectively show up. So with today's episode, I wanted to mix in some education on ADHD. We got a little bit. There's so much more, and then we're going to go into now ways to approach it, ways to help your child with ADHD. So the first one really is just that self-awareness. Self-awareness, and the second step after self-awareness is moving past or moving to not past moving to communicating with your child with mental health friendly language. And there was a previous episode on that I want you to check out, ways to support your child, and it's making sure you're not attacking them. You're focused on them as a human. You're not focused on their condition. You're talking about their condition and looking at how it shows up, but that is not the bread and butter, if you will. You're remembering that this is a human being in front of you, and they deserve kindness, love, and respect. The other area that you could do to support your child with ADHD is teach your child exactly what it means. And that means that there's a mixture of homework. Maybe I sit down with my daughter and I go, do you know what the acronym stands for? And then we talk about that. I may bring up different types of medication and say, this is a short acting. This is a medication that is long acting, and just, simple terms there. This one's going to work for a blank amount of time. This one's going to work all day long. And here's some side effects. Let's break down what the word side effect means, right? So we're going through those things together. The other item, and this is especially if your child's in school or even in college, is looking at an IEP, an individualized education program. Overall, it's where you're able to, and IEP sometimes can get a little bit mixed up with a 504, but overall, it's where your child's in school and they have accommodations, they have a little bit of support. So, with having ADHD, that means that executive functioning, the frontal portion of the brain, it's going to have a hard time paying attention, focusing, sitting still, retrieving information. So maybe an accommodation could be a quiet room to take their test. Maybe an accommodation could be a little bit longer to take their test, right? Small accommodations like that can go a long way. And then later when your child goes to college, they won't be able to use that same document, but they can still work with their accommodations department with the university. And there, that's really just talking to that department. They can reach out to their counselor. We work with many college students. And then what we do, some clients of mine are college students, is we'll reach out to the university and provide them with the documentation that they need. And then for some reason they need anything more, then that could be a primary physician or a psychiatrist. But overall, in the college setting, they're able to, again, have those accommodations. Because, what are we doing at the end of the day? At the end of the day, we're acknowledging that, okay, I have this ADHD, and here's what it means. And then for me to be successful, here's all the things that I need to do, right? And I had another really great example of this. They were like, imagine if you're wheelchair bound. You would have a building that would have a ramp and a wide enough door to allow you to come in. And those are your accommodations, but it doesn't take away the disability, if you will, right? It doesn't take away that variable of being wheelchair bound. So here, when we look at ADHD, it doesn't take away that variable of ADHD, but we can look at what are the accommodations, what are the tools, the resources. When we look at research says that medication can be 2 times, right around that variable, 2 times as effective as other approaches. I strongly encourage I strongly encourage education. Learn about different types of medication. Sometimes that's for people. Sometimes it's not. I'm more of just sharing with you information that's out there. I like the approach of let's bring in as much as we can, which would mean let's bring in a counselor. Let's look at accommodations, maybe at school or at work or K through 12, elementary, middle, or high school, or in college. Let's look at accommodations at work, because that's a thing too that a lot of people don't know about. You can have accommodations at work. At the end of the day, your work wants you to be productive and effective. So having accommodations just increases that level of effectiveness. And the last item that I have here for supporting your child with ADHD is compassion, right? Compassion. Love them. Love them, love them, love them. I mentioned in a previous episode the importance of fostering a space of affection with your child and with your family system. There's a lot of good research that goes into having that space of affection. It promotes a healthy well-being, a healthy level of emotional success, if you will, within the child and within the family system. So my hope is just kind of a recap here on today's episode is that you got a top layer view, right? We're understanding ADHD stands for Attention Deficit Hyperactive Disorder. You know that it impacts that executive functioning, right? Those areas connected to it, all the way from ability to make decisions, thinking things through, impulsive behaviors, and so forth. I didn't get into this area, but I think it's really important that ADHD can have a lot of different comorbidities. Now, what I mean by that is ADHD, there's a lot of research that shows a person with ADHD is very likely to also have anxiety or to have depression or to have behavioral conduct issues. And here's what I want to encourage you to look at that. That's unmanaged, right? That's the way I like to view it, right? Unmanaged. So let's do the work, right? Let's do the work. Let's step up to the plate. If you notice you're an adult and you think at this level of life you're seeing some of these symptoms of ADHD, or you see it in your child early, right? Early intervention. And then once we know, okay, there's ADHD, we start doing the work, start providing your child or yourself with tools that support with executive functioning. So that's, just as a simple example, that is looking at your child. If they have ADHD, instead of giving them this one giant assignment and saying you got to get this huge thing done, what you would do instead is you would break it down into pieces. And then as you break it down into pieces, you would provide breaks in between those pieces, so that they're able to have this nice amount of energy for one. They complete it, maybe some sort of reward to support with the dopamine. That's that feel-good hormone. And then from there, they go back and they do another one, and they continue that process, right? Your child learning how to approach life in their own unique way, it could lead to an immense level of success, right? And I think as we get older, we know that, right? As we get older, we learn through trial and error that it's okay if we do things a little bit different, right? You have to find your own groove in life. And that's really what all this is you're looking at, okay, I have ADHD. What tools, what accommodations, what variables do I need into my life so that I can still reach and go towards the goals that I have? I hope that you found this episode helpful. Again, on the topic of helping your child with ADHD, of learning a little bit more about ADHD. It's something that we do a lot of work with in the practice of Santos counseling. If we can be of help, please reach out to us. We are here, if you will. We are here to be of help, and we really honor that space. Honor the space of supporting you. Take care, and I will see you in the next episode.